Okay, it's on.
Okay, this speech will be about smoking, the health problems, and why we should or shouldn't legalize marijuana. Congestive heart failure, massive strokes, heart attack, lung cancer are just some of the life-threatening conditions or diseases caused from smoking. These will all kill you. Experts believe that smoking marijuana will cause the same health problems as cigarettes. I'm sure most of you know someone that did or did not smoke cigarettes or marijuana regularly. Most of us know that Colorado has legalized it for recreational use. We have had friends, family members that have smoked or been smokers. We know many that have also still use it. Both of my parents were heavy smokers all their lives, or most of their lives. My mother quit in 2007 after 40 years of smoking, and my dad quit in 2013. I also grew up where marijuana smoking as well. Both of them were recreational users. Now that my parents are in their 60s, they have many health problems associated with smoking. Okay. We'll begin with some health issues caused by long-term smoking of marijuana or cigarettes. Number one, lung cancer is the number one preventable disease caused by smoking. Experts believe that lung cancer from smoking marijuana will quickly grow to be the number one preventable disease. Smoking from cannabis has also been known to cause cancer. Chemicals such as hydrogen cyanide and ammonia at levels 20 times greater than tobacco. According to the American Heart Association, male smokers are 23 times and women are 13 times more likely to get lung cancer than non-smokers. Heart disease is the umbrella that covers many diseases of the heart. People that smoke are 4 times more likely to develop some types of heart problems. The chemicals in cigarettes, nicotine, and the chemicals in marijuana reduce the amount of oxygen to your heart, and it raises your blood pressure, causing more stress on the heart. 1 of 5 deaths from heart disease is directly related to smoking. Stroke risks double from smoking. We'll talk about some of the states that have passed marijuana laws. 25 states and the District of Columbia have approved marijuana for medical purposes. Colorado, Washington, Oregon, Alaska, and the District of Columbia have also approved it for recreational use. Colorado passed the marijuana medical law in 2000 and recreational use in 2014. Kansas has not passed either. A study hospital was set up in Colorado Springs to do research on cannabis patients. It began in 2009 and put statistical data information out in 2014. The study hospital discovered that financial impact on the healthcare system outweighs any tax revenues and that the state may get from the taxes paid placed on marijuana or the product. During the study period, the study hospital had actually lost of $20 million. These seem to come from uncollected charges. The number of cannabis patients increased and are not always able to pay for the medical bills. The hospital felt this amount was underestimated and could be much higher. The money for medical care is not the only problem that is out of control due to marijuana use. Car accidents are an out of control expense. Marijuana is a drug and it affects our reaction time, our complex thinking process, our hand and eye coordination. It changes our perception of time and distance. These are the abilities we need to operate a car. In 2010, an estimated from the National Highway Traffic Safety is that one traffic accident has a fatality cost of $1.4 million in cumulative cost. There are 87 related car fatality accidents in 2014. If you calculate 1.4 million times the 87 accidents, it will cost you $131.6 million. I think we have an understanding of what could happen if marijuana was to be legalized in Kansas. It says, today we have learned a few facts about the health issues that are attributed to smoking cigarettes and that these health problems are the same for smoking marijuana. We've learned which states have allowed marijuana to become legal and know that our state, Kansas, has not approved it yet. We also learned that the horrible amount of money marijuana and driving could cost. As a member of the medical community, I really do not want to see any increase in the health problems created by marijuana use. We have really worked hard as a nation to educate, and I think we have dramatically lowered the number of cigarette smokers. I hope that we will not allow any more states, and especially Kansas, to pass the medical